This is my client John, and he flew from Seattle to get treatment for his coccyx, and we found a left side bent coccyx and treated it, and on the first day we were able to get it straight and restore normal spring mobility on the tailbone. And on the second day we only did soft tissue work.
Right.
And I'll let you, this is the third day, and I'll let you tell us how you're doing and how sitting is.
Yeah, so actually there's three things that are interesting. Sitting is still a little bit challenging on my left sits bone, but it's way better than it was. What's really interesting though is that for the last 2 nights I've slept really well, which I have not been able to do for probably 2 or 3 months. The night before I slept for 6 hours, and last night was 7 hours, which was amazing. Also, I noticed something interesting. Whoever's listening to this maybe won't understand, but you gave me some blocks to put under my shoulders.
Yeah.
And when I was using it today, I felt like there was some kind of activity in the coccyx area.
How interesting.
Like a movement. It was very strange.
How
It felt
interesting.
really good. And then the third thing is when I was walking this morning, I noticed that that a soreness that I've had in my left hip seemed to have shifted to the right, almost as if the compensation that has been going on is being rejiggered or something.
Yes,
All that to say, I'm very happy I came out to see you. So
nice, very interesting. I think it's fascinating that you laying on your stomach with a 5-inch piece of foam under each shoulder.
Right.
We found tightness when I pushed on your shoulders, and that's why we did that treatment to bring your shoulders back, and we had you lay on that for 5 minutes. And I think it's fascinating that laying on that caused you to feel some activity around the coccyx.
Yeah, I guess my spine was doing this, I suppose. So it somehow felt like something was being activated, or I'm not quite sure what it was, but it was interesting.
Yeah, yeah. So you feel that straightening out the coccyx and restoring coccyx motion was helpful?
I'm pretty sure I haven't done anything differently. So other than that, my sleep has improved. My ability to sit longer has improved. And I have a feeling that it's just going to get better. So I'll report back to you.
Nice, nice. Yeah. And I find the side bent coccyx to be the most common type of coccyx injury, but it's also the least understood. If you go on the internet and you search side bent coccyx, boom, my name pops up.
Right.
So not many people are talking about it. And I freely share information. I've posted on YouTube videos, multiple videos on side bent coccyx. And it takes an external evaluation, not internal. And the treatment takes a while. It takes 10 minutes, not 5 seconds, 30 seconds that I hear about.
Oh, you mean like with a chiropractor or something?
Yeah, and also some people that do internal mobilization on the coccyx, like pelvic floor therapists, they seem to do it just very briefly, and I don't understand why.
Well, as you know, I've gone to acupuncturists, chiropractors, physical therapy. None of it did what I was trying to get accomplished. And so if anyone has anything even related to a coccyx problem and they don't come to see you, that's their fault if they don't get it resolved. So I highly recommend people make the trip if they can.
Thank you. Thanks very much.
Sure.